Okay, good afternoon. My name is Damon Brathwaite. I am an outreach manager for PSS, Circle of Care. Thank you for joining our webinar today. It will begin shortly, and we are actually going to be speaking on the topic or learning about the topic on how to advocate for your loved ones. And Cynthia and Carla will be presenting to you guys today, so please stay tuned and listen to gather whatever information that may be resourceful for you. A little bit about PSS. We were founded in 1962. We're a multi-service agency. We service all 5 boroughs in New York City. We offer educational and online programs. We also have 9 local centers, and other locations are designed to help older adults stay healthy, engaged, and connect. The services at PSS Circle of Care ensure that those caring for someone who is frail, chronically ill, or has memory loss are not left alone. PSS Circle of Care also serves kinship caregivers families, where the grandparents of the family member other than the parent is raising a child 18 or under. Our coming of age program is a leader in the positive aging movement. Learn more at pssusa.org. Please type any questions or comments in the chat box. We will respond to as many as we can throughout this webinar. Again, thank you for participating. To learn more about PSS, please visit our website at pssusa.org. To look at events, you could go to pssusa.org/events. You could also contact us at office@pssusa.org. Thank you.
Good afternoon. I want to thank you all for joining us for a very important topic. Do you have what it takes to be a patient advocate? This is either for yourself or for someone that you care about. I am Cynthia Perthuis, and I am an elder care strategist and owner of Senior Care Authority. I am joined by Carla Holub, who's the owner of SelectCare Home Care. Today, we're going to walk you through a fairly comprehensive view to help you make some very important plans for your life. My team helps older people find a safe and healthy living option when they are ready to find a community that caters to their specific wants and needs. We also work with families that want their loved one to stay home but need help with all of the required resources. We work with people in the 5 boroughs of New York City and the southwest coast of Florida. We work with a nationwide network and can help find assisted living anywhere in the United States and Canada. I'm going to turn this over to Carla.
Good afternoon. My name is Carla Holub, and I'm the co-owner of SelectCare. SelectCare is a licensed home care service that's been providing home health aides and nursing to New Yorkers since 1985. Our goal is to ensure that the care we provide supports the client's wish to remain as independent as possible in their homes, wherever that may be.
So let me tell you a little bit about the Beatles. I think we all know about the Beatles, but one of the things that they were very popular in the 60s. And for those of you who have heard my presentations before, you know that I like to start with a musical reference. They need no introduction, nor does the song help. However, I'd like to take a few minutes to think about this song in a different way. I'm sure that the young boys that wrote and recorded this song were not thinking about patient advocacy, but the words ring true and they take on a special meaning when thinking about where we may be in life or where our loved ones may be in life. And one of the things that's so important is that they talk about when I was younger, so much younger than today, I never needed anybody's help in any way. But at the end of that chorus, they say, won't you please, please help me? And that's something that an advocate can do. Let's think about the word advocate. What do you think of when you think of advocate? Protesters can be thought of as advocates. They are speaking out about things they feel passionate about and speaking for those that may not have a voice. An advocate speaks publicly about the cause. You can advocate for others, and you can advocate for yourself. This presentation will help you learn and figure out, do you have what it takes to be an advocate? Have you identified an advocate? Do you want to be an advocate?
So let's look at specifically what a patient advocate is. A patient advocate has a defined role and defined responsibilities. The role of a patient advocate is to ensure that the medical team understands what the patient's wishes are and helps the patient understand what the options they may have regarding their care, medical treatments, and outcomes are. Some advocates are formally designated in writing and are known as healthcare proxies, and some advocates are informally chosen or naturally fall into that role, such as a child accompanying her mother to a medical appointment so that she can ensure her mother understands the results of a test. But whether you're formally designated or just happen to live close to your mom, thus tagged as her advocate, your job is to ensure that the patient has a clear understanding of what is happening and the medical team has a clear understanding of the patient's wishes. Basically, you are a conduit of communication. So why do I need an advocate? Everyone needs to have a designated person that they trust in the event of an emergency. But also think of this, we as caregivers we always think about everyone else, but you also have to remember to take care of yourself and prepare should an emergency happen. So take care of yourself and choose your own advocate, not only as that you're also in being prepared for that. So there's a lot of vocabulary that surrounds patient advocacy. But on the key to remember on this slide is the more that you have documented and formalized, the less you have to scramble in an emergency. So if we take a look at each one of these items, I just want to go over so that we all understand what these items are about. First of all, the living will. This is something that is written. These are directives regarding your health care should you be unable to speak. The healthcare proxy is also a formally identified person who's your representative to ensure that your living will is followed. And this is the one thing that we also have to remember about the healthcare proxy. You are not making decisions for the client as a healthcare proxy. Your job is to follow the written directives that the patient has already written out. The power of attorney is a legal documentation, a legal document. The patient has identified people who they trust to make decisions on their behalf. So the healthcare proxy is only following what the living will is telling them, but the power of attorney is making decisions on the patient's behalf. Please note that the power of attorney is a legal document drawn up by attorneys and must be notarized. Banks and other financial organizations will require a notarized copy of the POA before they release any information regarding finances, insurance benefits, or medical information. Now, you can change the name of the power of attorney. You can update them at any time. However, it must be updated through an attorney and notarized. And I keep stressing notarized. Many people will write up something that they just download off of a computer. Unless it's done by an attorney, unless it's notarized, it is not recognized. The power of attorney is not recognized. However, the healthcare proxy and the living will can be changed at any time, and they don't need an attorney. But if you are changing or updating these forms, you should have them attached to the power of attorney papers. I always suggest that you review these documents regularly to ensure that you still want the named persons to be responsible for your financial and health decisions, and also make sure that any changes are always written down. I have a 58-year-old friend who had her brother as the power of attorney for many years. They were in business together. The business broke up. She had talked to people about changing her power of attorney and her healthcare proxy. In August, she fell down a flight of stairs and is now in coma, and her brother still remains as her power of attorney and as her healthcare proxy. So anytime you want these changes done, make sure they're written down. Let's go to the HIPAA. HIPAA is the Health Insurance Portability and Accountability Act that protects your personal health information. Unless you have a written document, the power of attorney, organizations will call out this act and say we cannot give you any information, health or financial, with anybody unless they have written authorization to release the medical or financial information. The other items on this vocabulary page are advanced directives, DNR, full code, and MOLF forms. So advanced directives are basically your directions, the patient's directions, what they want to have happen at end of life. However, a DNR, a do not resuscitate, only provides instructions about CPR. If you take a look at the MOLF form, and usually everybody knows it as the pink form, the MOLF form is a far more dynamic document. It covers a variety of end-of-life treatments, and at the end of the MOLF form, a physician is required to sign off on it. Most of these the MOLF form is usually kept somewhere that is easily accessible so that in an emergency, your patient advocate can grab it and go with you to the hospital and present it to your medical team. Usually, physicians also have the MOLF form somewhere in the patient's medical file. Thank you. This is an interesting holiday season that we are just starting, and it's a good time to possibly sit down with family and start discussing the choices of their patient advocate. Who would they like to have as a patient advocate? Sometimes parents will say, well, I just assume my husband is going to take care of it, or your dad will take care of me. Your dad will help me make these decisions. But if you take a look at the whole family dynamic, you also want to consider and maybe have a conversation about what are dad's illnesses. Will he be able to make some of these decisions if he is still your healthcare proxy? And do you think that he would be a good patient advocate for you at this time? Maybe 30 years ago when mom and dad were sitting down and talking about their wills and their advanced directives and how things would happen, they were both okay to be each other's patient advocate. Now is a good time during the holiday seasons, find a quiet spot and sit down and start talking about these things. You also want to take a look at when you're talking to your parents or your spouse about being a patient advocate or a healthcare proxy, is make sure that their philosophies on life sync up with your own. Sometimes one person has a certain hardline rule on organ donations, and you want to donate your organs, the other person doesn't want to donate their organs. Make sure that you can sit down and talk with each other. If that person is not in sync with your wishes, you may want to identify another person who is capable of being your patient advocate. Also, if somebody chooses you to be their patient advocate or their healthcare proxy, understand what your level of comfort is in this role. If you don't feel comfortable, if you are too emotional when it comes to discussing care services for your loved ones, you may want to bring in a professional. There's a variety of people that can help with this in making decisions, in being patient advocates, and there's quite a few of them in New York City. There's elder care strategists, nurses through home health care providers, and geriatric care managers. These professionals will charge on a fee, but the services may alleviate you from being so close with some of the decisions that your family, your parents will may be making. As always, everyone should advocate for themselves. I know that many times we want to be good patients. We don't want to discuss or question the medical team too much, because then we'll be designated as a bad patient or one of those people. You may want to see where you are and have your own patient advocate come with you when you go to your own medical doctor's offices. Next. There's a lot of people, professionals in the elder care profession who can assist in being patient advocates or even helping families determine what is good for the patient, how you want to handle your end-of-life situations, or even come in crisis situations, help organize things, and then move on, but be called in when there are emergency situations. There's social workers, there's geriatric care managers. They provide the support and guidance to older adults and their families. So you don't always have to have this whole group every single day. You may want to look at them as a planning team for both the long-term goals and short-term goals to address a person's needs and preferences. So how soon should we prepare to have an advocate? I always say when skies are blue, when there is no crisis, no stressful situation, sit down, talk to family members, get a plan in place. This is also an ongoing conversation with people who you trust that will follow your instructions, or when you're unable to advocate for yourself. And remember that except for the power of attorney, documents such as living wills and healthcare proxies can be changed without an attorney. The most form will require a physician's signature. And you also want to remember that when you are a patient advocate, the actions should always reflect the current wishes of the client. What their wishes and concerns were maybe 5 years ago, or when you had a diagnosis of cancer, the first diagnosis of cancer, their wishes may have been different than as you've traveled down this path with the diagnosis and the illness. Always, as a patient advocate, continue the conversation with the patient, with the loved one, to figure out what their current wishes are and how you can benefit in keeping the medical team updated. And also, last but not least, advocacy is not linear. I always look at hills and valleys, peaks and peaks and valleys, where you may have a crisis situation such as a fractured hip. In a crisis situation, your mom may have fallen, and you have to figure out what are the rehab options, helping her to determine what rehab she wants to go through, or help the medical team understand that your mom doesn't want to go to rehab, she wants to go home, and how can we make this happen? And then once everything settles down, you're down into a valley where things have settled down and you can kind of pull back from your role as patient advocate. It is always peaks and valleys. So I always say, what are the responsibilities of a patient advocate? Minimally, keep up-to-date records, advance directives if they've changed, your current medication list. All of these things help the medical team when they are reviewing the care for the person who you are the patient advocate for. It's always great to have them someplace where it's like a grab and go. Keep up-to-date calendars on doctor's appointments and treatment appointments, because physicians, if you have to see a new physician or a new medical team, they will ask you, when is the last time, when was this diagnosis made? What was the date of the diagnosis? What was the proper name? Know the proper name of the diagnosis. And always continue to update contacts at doctor's offices, in home care agencies. Know the correct person who you are supposed to speak to, and what are they doing as a participant in your in that patient's care. Thank you.
So it's very important that one of the first things you do to prepare for patient advocacy for yourself or for others is to collect the important papers. We'll provide you a list of links at the end of the presentation where you can find these documents, and we'll send these links out to the participants of this event. You'll need copies of legal documents as well as list of medications, doctors, specialists. You can keep these things in a variety of ways. So when I was taking care of my parents, I carried around a 3-ring binder with everything in it. I traveled a lot for business, and I would always have this binder with me when I went on a trip. When my father died, I was in a hotel in California, and I got a call asking for the healthcare proxy information and if I had his DNR. I was able to help even in this terrible time of crisis from 2,500 miles away from where my father was. I have a client that carries as much as she can in her purse. We laugh and say maybe that's why Queen Elizabeth carries her purse with her everywhere. There are also some technology solutions, and we'll discuss one of these later in the slides. You want to definitely beware of advocate fatigue, and you may also have heard this as caregiver fatigue. It can have some of the same symptoms as caregiver fatigue. You may begin to experience physical, emotional, and financial heartache. You need to try to stay focused. Do any of you know the book When You Give a Mouse a Cookie? You know, it starts off simply with when you give a mouse a cookie, he's going to want some milk. And it moves pretty quickly to the fact that he's also going to want a napkin, a whisker brush for the crumbs, a goodnight song, a tuck-in, etc. Maybe even another cookie. Don't get in the spiral of becoming more than an advocate. Stick to what you know and what you signed up for. My sister and I had some very specific strengths and weaknesses, and we split the duties so that we could get rest from all of the activities of being a patient advocate. A patient advocate also needs to be aware of community resources. You do not have to do this alone. These resources can help guide you along the way and may even be able to lighten the load by taking on some of the tasks that you are working through. PSS is an exceptional community resource, but you'll also see that physical and occupational therapists, home health care companies, social workers, visiting doctors, psychotherapists, as well as comfort care, hospice, and palliative care. Carla is going to talk to us about the case studies that we have shown here.
I'm sorry, I was on mute. Since 1985, we've had many clients who are in different aspects of taking care of themselves. And these are, when you talk about patient advocacy, these two come to my mind right away, and these were actual clients. We had Miss Smith, who was very independent. She needed physical assistance during the day, but she was right up there with all of her medical papers. And at 1 o'clock in the morning, she fell. She crawled to the phone to get the phone to call the EMTs. And when the EMTs came in, they kept asking her all these questions, and she kept saying, "Get the binder, get the binder." They were able to get the binder. They found out what was going on, and she was given immediate and appropriate care in the emergency room. So, and her care was provided according to her history and her wishes. I do want to let you know that in this case study, that the one thing that Miss Smith didn't have and was resistant to was a personal emergency response system. And when she came home, the first thing she asked us to help her with was how to get a personal emergency response system, also known as the Help I Can't Get Up button. Mr. Jones, on the other hand, it was really sad. Mr. Jones was the primary caregiver for his wife, who had a diagnosis of advanced dementia. Mr. Jones actually had to go in to take care of his own issues, which were cataract surgery. And although he was encouraged to hire help through a home care agency, he assumed his son would help them. Well, the son called SelectCare, and we went in there to provide home health aid service. At the time that our registered nurse went in there to make an assessment, Mr. Jones had his wife's medications in a plastic bag hanging on the bathroom door, Post-it notes on the refrigerator reminding him of medical appointments, and he was unable to find his own doctor's contact information. If there was an emergency, it would have been a real sad situation for Mr. and Mrs. Jones. What we did is we went in there, assisted in getting the core information needed, and then helped Mr. Jones identify a geriatric care manager who was able to come in and help him get even more organized. At the end of the time that we were providing care for Mr. and Mrs. Jones, we realized why he didn't want to ask his son to be his patient advocate. And it was because his son had his own health issues and was unable to provide that assistance to his father. So with geriatric care management, with home health aid services in there, we were able to help Mr. Jones pull everything together, get things organized, and he was then able to provide better care and more consistent care with his wife.
So I'd like to quickly talk to you about a technology solution that we work with. It's called the Caring app, and it was developed by a team in England that had experience with that 3-ring binder that we've mentioned many times here. They were having trouble remembering the 3-ring binder, these children of their parents. They couldn't remember, was it in the car? Was it in the closet? The pages were falling out. The brothers and sisters wanted some information. So Senior Care Authority worked with them to develop something that was more portable and transferable. This product allows you, it's for smartphones and tablets, and it allows you to put a plethora of things on your mobile device that you can keep with you and that you can carry with you. You can use a microphone to dictate the data in, or you can type it in. You can share the app with others, and you can add up to 4 photos in most sections, and a lot of information can be added in a little amount of time. So as opposed to entering in the prescription number, you can just take a picture of the prescription bottles. It keeps the emergency contacts, the driver's license, health insurance, if there's any veterans info. You can also add your own categories. Is there someone that you'd like to have a member of a religious group come to you, and who would that be? You can put your Medicare number in. You, again, can add your own categories, and this is all very highly protected from, even though it's on the internet. You can also type in conversations and decisions that you need to remember. So you toured assisted living, and you went to Kara's house and you had a discussion about the assisted living, and you can put pictures of what you saw at the assisted living location during the tour. It allows you to put dates, procedures, and notes. So when you go to a doctor and the doctor asks you some questions, you can pull up the app and you can say, there was, a steroid injection in 2017, the colonoscopy was performed in 2017. You can keep a list of the procedures that have happened. Again, you can put your medication report. What is the dosage? What is the name? You can also put why do you use this? Why is this important? It again allows some very comprehensive look at medications. Pictures of your passport, pictures of your MOLST or your POLST, pictures of your advanced care directive. You can list, where is the passport? It's in the filing cabinet. What else is in that filing cabinet? Dad's birth certificate, power of attorney. That way you don't have to carry all of these things around with you. You have them there. Same way with the bills. You can put financial information into this application. If you have a helper or a healthcare or an aide, or if you're 2 siblings who are taking care of your parents and one comes in on Monday and one comes in on Friday, or you split the weekends, you can keep the daily schedule on this application so that you can keep some things in order with your loved one. This is also very helpful to speak with your other siblings so that they all know what each person is doing. Sometimes the siblings can get into a situation where they say, I'm the only one who's working and no one else is doing anything for mom or dad. I'm the only one who does it. Sometimes siblings pay each other to do this work. And so this is a way to keep up with billing. Now, there's a dark side to patient advocacy, and it's different from fatigue. So I'm sure many of you remember the Brooke Astor story, and her son eventually went to jail for elder abuse, and it was all over the papers. We don't know really the ins and outs of that, but we know that he may have started out as a strong patient advocate for his mother. We don't know why or when he crossed the line, but you need to be wary when choosing your patient advocate that you trust them. Be wary also when you are agreeing to be a patient advocate that you have the stamina. As Carla mentioned in the case with Mr. Jones, the son who they thought would be the good patient advocate had his own health issues. He may have needed a patient advocate as well. So it's very important to think through this very important decision.
The one thing that I can say here is always to remember that the best plans are only as successful as the patient allows them to be. And with that, you always need to keep in conversation with the person who you are being the advocate for. And always understand that things change, life changes. What may have been your short-term or your long-term goals at the very beginning may change. So always review with your parents or even with your own health advocate what your long-term goals are and what your short-term goals are. Plan ahead. Sometimes just sitting and talking about the what-ifs really helps identify what your actual wishes and concerns are, and it allows the patient advocate to adjust their thinking and their way of presenting your concerns or your wishes to the medical team. There is no silver bullet in this. God bless you if you have taken up the mantle of patient advocate or healthcare proxy or power of attorney. It is a long road. But the one thing that we always say is make sure you get support for yourself and that you have somebody who you can talk to and run things by. So also know what your rights and responsibilities are. You know, if somehow you get into waters where you're not really sure what your rights, your responsibilities are, reach out to professionals. Reach out to the community resources, reach out to PSS. They will be able to assist you and guide you. Also, it's great to build a team of experts. There's a whole list of professionals in the elder care profession that can assist. Sometimes you need them at the top of the list. Sometimes they fall to the bottom of the list. It helps to have a supportive network of experts that can create that team effort for both you as the patient advocate and also for the patient advocate themselves.
So we will send out these slides with links that you see here that can get you to all of the forms that we talked about, as well as the information around the Caring app. If you're interested in the Caring app, you will also have, this is Cynthia, you'll also have my contact information, and you can send me an email and I can get you the code for you to be able to use the Caring app at no charge. And, you know, as we've discussed, there are several experts that you need on your team. Some charge a fee, others can provide services at no charge. I may sound like a broken record, but the key is in the experts. And you cannot and should not do this alone. If you're interested in recommendations for experts, feel free to send Carla or myself an email and we can get you that information and help make suggestions for your specific circumstances.
You know, I look at the professional connections that I have made throughout the years with community resources, with geriatric care managers, social workers, and I want to say that it is a pleasure meeting up with Cynthia because we have recommended many clients who no longer need home care or who no longer want to be in the home care setting but are looking for the next step, which is to assisted living. And it makes me feel good as a professional that I am able to look into my community resources and know that Cynthia and her organization is there for my clients. So, Cynthia, thank you for letting me be part of this. I truly appreciate it. And for the participants, if you have any other questions, we would be happy to hear from you.
So now would be a good time for, you can either type your question into the chat box or the Q&A box, or Stamen, I guess you can open up the microphone for people to ask questions.
Yeah, so thank you so much, Cynthia and Carla. This was some resourceful information. I hope everyone actually got the answers that they were looking for. Now, again, if you do want questions to be answers, like Cynthia said, you could definitely type it into the chat box, and we'll respond to, well, Carla or Cynthia will respond to your questions there. We do not want to open up the microphone right now because we don't want too many people to be speaking at the same time. So the perfect thing for everyone to do is just type your questions in, and I'm sure you will get the answers that you're looking for. Thank you.
So I'm not seeing any questions, but again, we will send this slide pack to your email address that you registered with, and it has our contact information as well as the links, and feel free to contact us with any questions. And I want to thank, again, PSS for letting us, PSS Circle of Care, for this opportunity. I want to thank Carla and her team for getting us getting this information and helping me with this. And we look forward to working with you all and answering your questions. So thanks so much for giving us your attention today.
Thank you all. I do see a question just came in.
It says, how can I print a copy of the PowerPoint for notes?
Mm-hmm.
And the next one from Jamila was, do you need a lawyer for a power of attorney? Yes. Simple question, simple answer, yes. You can contact an elder care attorney, but most general attorneys will be able to write out a POA. But the other thing too is to make sure that it's notarized.
And feel free to send us, you can send me your email. I'll send you a list of 3-5 different elder law attorneys that could work and could do that for you. And as far as printing it out, we'll send it to you so that you could print it out at your convenience.
Thank you for those questions.